LOTUS Edge will make a big difference for physicians. A 5-fold reduction in the risk of paravalvular leak, a far lower rate of disabling stroke. The delivery catheter itself is more flexible and it's also thinner, so it moves more freely as you're traversing the abdominal aorta. The valve, because of depth guard, will deploy in a different way. It'll actually anchor early. They'll also notice radio-opaque markers to make it easier to lock. So the beauty of LOTUS Edge, knowing that you're going to finish well, know the result's going to be great, it's going to give the physician confidence to perfect the technique and get a good result.
We discuss the cases of the day. We also look at all of their slides or films that we have gathered and figure out what they're doing before they ever go into the case.
My sense is we should start off with a 25.
The only concern then, Joe, is heart block, right? Meaning a larger valve, potentially putting the valve maybe a little lower.
We're going to put in a 25 millimeter valve, but there are some measurements that would suggest maybe it should be a 27. You know what? This is a beautiful thing about the valve. So we can put it in.
We don't like it.
Right.
And if we don't like it because of the way it looks, then we can take it out, right?
Right.
So let's do the 25.
Dean, are you ready to go?
Yeah.
Okay, just talk to me.
That's a nice position there, Doug.
Not
Leave
yet.
it right there, okay?
Hold it.
Pulling back on the wire.
Yeah, that's good.
There you go. See it? That's great, Ian. Perfect position there.
Our patient is in her 70s, but she's frail, lung disease. This is another patient subset that will really do well with the LOTUS Edge.
A paravalvular leak and permanent pacemakers tend to be what are our main problems. And I think this valve addresses all of those main problems.
Yeah, going up. I think you're going to have to rotate it.
LAO here.
Put the back lights down, please. I'm going to cross into the ventricle.
Pressure's perfect. Nice and slow. The depth guard is really clearly a difference in this valve compared to the first gen. Probably the biggest challenge at that time was trying to figure out if you locked it. You know, after you deploy it, you're looking at the cuff, the buckle, the post, which all of that process has been infinitely simplified. That's very nice. Very nice. I think we're in a good spot, too, to lock it.
I think the 25 was the right way to go there. With the adaptive seal, it's much less likely to result in leakage around the valve. That doesn't happen. The adaptive seal works.
When we take our post-aortic root shot, there really is completely no perivalvular leak.
Get the valve over a little bit just so that you can see the ventricle. Okay?
Ready?
Yep.
Wow. Great. Beautiful result. Beautiful result.
Very smooth delivery, didn't have to push, didn't feel like you were jeopardizing the patient or causing any unnecessary risk to the patient. I'm pretty convinced there's a huge difference there, and I think it makes a big impact in terms of the electrical stability of our patient.
That valve looks beautiful, guys. It really does. Looks fantastic.
With the LOTUS Edge, we've not experienced the dip in blood pressure.
The control situation is wonderful. The patient's blood pressures can be very stable throughout the whole course. You don't need to chase yourself because the blood pressures are too low.
Pressure's perfect, guys. Very nice. Right. You don't have the intensity of rapid pacing. If you have to partially recapture, it's not a big deal. You can completely deploy the valve and completely recapture and redeploy.
It's really the best system to decrease the anxiety of the operator and really optimizing the outcomes in terms of placement. How you feeling there, girl? Whoa! You got a new valve. It looks really good, okay? Hang in there.
I would definitely recommend the LOTUS Edge.
I'd say it's a very valuable component of the armamentarium for TAVR.
By shortening the procedure time, being able to more efficiently lock, being able to visualize better, being able to plan implantation more accurately are all positives for patients.
I think the iterations that have been made in this second generation with Edge really make it much easier as an operator. Making the procedure easier for the operator usually means the outcomes are better for the patient.
Mr. Brady had an excellent result. He had the TAVR procedure done on a Tuesday, was up and moving around later that day.
His color's good, his energy level is great, and he's even offering to help me do chores around here.
I just felt like a normal person, walking a couple of miles out there, the heart just ticking away.
The LOTUS Edge for him was the answer.
One way or another, I can use this in every case. I know that I can get that perfect result with the LOTUS Edge.